As you already know, I'm all about managing stress, managing it effectively, managing its effects on you so that they can be minimized or eliminated whenever possible. But sometimes it can be confusing to figure out or understand how stress affects you. And sometimes it's difficult to connect the dots or to make that connection, to make that association. And I think from what I've seen, from the feedback that I get, from the people that I've worked with, sometimes figuring out how stress affects your mental health, your emotional health, can be a little more difficult to figure out than how stress affects you physically. So today I want to list some of the ways that stress can affect your emotional well-being, your mental health, so that you know that this could very well be something that's related to the stress in your life, rather than looking at a symptom, not realizing what is contributing to it or what may be causing it, and dismissing it because you don't know what to do about that symptom. You don't know how to deal with it. So today I want you to pay attention to the list of symptoms that I'll name. And by no means is this an all-inclusive list. This is just a general idea so that you can begin to figure out what's going on with you on your end, and how and if perhaps stress is the culprit. Stress is the root of the problem. So let's look at our mental health, at our emotional well-being, and how stress can affect it. So first and foremost, let's look at the mood. You can very well be affected. Your mood can be affected by stress. That could mean changes in mood, that could mean irritability, that could mean anger, that could mean sadness, or even depression. So definitely pay attention to your mood. Are you experiencing changes in your mood? Has your mood changed in some way recently? Maybe it's recent for some of you, maybe it's been going on for a while for some of you listening or some of you watching. But the important thing is not to just dismiss it and say, well, this is how it's been for years, or this is what it is now. Don't blame it on other things. Don't assume that it's nothing, or that it's part of aging, or that it's unimportant, because it may very well be something that is caused or affected by or fueled by the stress in your life. And knowing that alone, you can then proceed to make changes for the better. If you can remove the root of the problem, or greatly reduce the root of the problem, you can then help with the symptom of what you're experiencing. So pay attention to your moods for sure. Some people may experience nervousness or anxiety as part of how stress affects them. And that's another one that may be hard to associate with stress. It may be hard to connect those dots. But if you are nervous, or if you've become anxious, which are both unpleasant to say the least, but they can affect your life, they can affect your ability to enjoy life, they can lead to further issues, not only with your mental health, but also with your physical health. They can affect so many areas of your life, including things such as your social life, your social exchanges, interactions, your relationships. So again, don't take things for granted, don't minimize things, but rather pay attention to them. So if you are experiencing nervousness, if you are experiencing anxiety, think about what is the root of that symptom. Where is that coming from? Is it potentially part of stress in your life? And then What can you do? How can you reduce that stressor, or maybe even eliminate that stressor to help with that particular symptom of nervousness or anxiety? Some people may experience changes in their confidence. Specifically, their confidence may not be what it used to be. Their confidence may be low, may have changed from what it used to be in the past. Again, that is not always obvious in terms of something that's related to stress. That is not always one of those things where it's easy to make that association or to connect those dots. But if your self-confidence has changed, if it has gone down, it may be because of stress in your life, because of specific stressors. So again, because it's not an obvious one, you may have to do some thinking about it. You may have to do some review of what's going on with you, what has been going on with you. Does it always mean that it's going to be associated with stress? No, but it could be, which is why it's important to be aware of it so that you can make that assessment, think about it, review what's going on with you, and then make appropriate changes so that you can help yourself, that you can heal yourself, you can make your own experiences better. Many people experience behavioral changes as a result of stress, and that is quite a wide category. So that could mean a lot of things for a lot of people. For example, you may no longer do the types of things you used to do, or you may start doing things that are out of your character, but it's something new that could be associated with stress in your life. It could be driven by the stress in your life. So pay attention to your behaviors. And sometimes it's easier to have others point out new behaviors than it is to notice them yourself. So if you don't see any obvious changes in your behaviors, maybe there aren't any, but maybe there are and you're just not seeing them. It doesn't hurt to ask someone who knows you well, or maybe a couple of people who know you well, whether or not they have noticed anything different as far as your behavior. And again, that could mean a wide range of things, but it could mean no longer doing a behavior that's been part of your normal behavior repertoire for a long time, or it could also mean doing new behaviors that are not part of your character, that are not really part of who you are, that are not your normal. So pay attention to your own behaviors, pay attention to the changes in your behaviors. And then if you don't see anything obvious, ask one or two people who know you well. And they may very well say that they too don't see any behavioral changes, and that's fine. But you won't know until you ask that question, be it of yourself or of those who know you well. This is important. This is an important thing to consider. It's an important thing to review. So pay attention to changes in your behavior. And some of that may include things like changes in your eating habits. Maybe you're changing what you eat or how much you eat, changes in your sleeping habits, that kind of thing. It's so easy to sometimes dismiss these things, but in reality, it's important to pay attention to these things because, again, if you are able to make that connection that these changes are associated with new stress in your life or new stressors in your life, that gives you an opportunity to then proactively do something about it, to proactively improve your situation. So pay attention to your behaviors and specifically to behavioral changes that may be associated with stress. Stress can also have an effect on our social lives. So that's another thing to pay attention to consider. Are there changes in your social life? Are you isolating yourself or withdrawing yourself from the outside world or from your friends, from your family? Are you no longer keeping up your relationships with people, or are you no longer as social as you used to be. And of course, how social you are is individual, so you have to go by what's normal for you. Or are you now associating with a whole new group of people? Maybe all of a sudden you are forsaking friends and family who have been part of your life for years, and all of a sudden you're hanging out with a new crowd or one or two new people who may or may not be good for you, who may or may not support your health and well-being, who may or may not encourage the right types of behaviors that benefit you. So pay attention to changes in your social life, in your interaction with others, in your relationship with others. It could mean that perhaps because of stress, you are allowing stress to affect certain relationships with your life for the worse. Perhaps you are avoiding people, as I already mentioned, or perhaps you are snapping at people or fighting with people. So you have to pay attention to these things because they may very well be related to stress. And one of the things that I think people often regret is allowing stress in life or allowing situations in life to affect their relationships in the sense of damaging or ruining their relationships. So pay attention to the social aspect of your life and whether or not stress is affecting that. So as you can see, there are so many ways that stress can affect us. And today I talked about how it can affect your mental health and your mental well-being, including things such as moods and behaviors and relationships. So pay attention to all of that because stress can have such a wide range of effects on us. And what I named today is just a small list of possibilities. So don't dismiss anything, but rather think about it, make an assessment, maybe talk to a trusted source, someone who knows you, to see what they think, to see what it is that they see as far as changes within you, as far as stress that you may be experiencing and how it affects you. It's always good to be aware because once you're aware, you can then go to the root of the problem and be proactive in making the kind of changes that are beneficial for you and that can help you today, tomorrow, and down the road. If you'd like to learn more about a comprehensive approach to stress management, check out the link below.